All right, we are live on Facebook. Welcome to today's Facebook live chat. I'm excited to be joined today by two very awesome members of the IBD community to talk about nutritional support therapy. So my name is Rebecca Kaplan. I'm the Public Affairs and Social Media Manager for the Foundation. And symptoms of IBD can sometimes make it difficult for patients to get enough calories and nutrition from food and supplements alone. So if this happens, your healthcare provider may recommend nutritional support therapy when IBD complications such as weight loss, surgery, obstruction, or severe inflammation prevent you from getting the right nutrients. Today, we're going to be discussing what nutritional support is, why it's used, how it's administered, and how the Foundation is fighting to help get it covered by federal health programs and private insurance. So I'm excited today to be joined by pediatric gastroenterologist Angela Sandell and IBD patient Ty Redler to discuss this important topic. Dr. Sandell and Ty, thank you for joining us today.
Thank you for having us. We're excited to be here.
Thank you.
So please note that information shared during today's chat is for educational purposes only. The information shared by today's speakers does not reflect the official position of the Foundation. And please consult with your doctor and/or a dietitian before making any changes to your treatment, diet, or nutritional supplements. If you're watching the video live, comment below, say hi, let us know who you are, where you're from, what your IBD connection is, and what experience, if any, you've had with nutritional support therapy. And lastly, to learn more about IBD and nutritional support therapy, you can visit our website at www.Crohn's Colitis Foundation, all spelled out, .org. Let's get started. So Dr. Sandell, let's just start with the basics. What is nutritional support?
Okay, so I like to think of nutritional support as like a pretty overarching theme of ways that we can use nutrition or use different dietary elements to either treat or enhance treatment for certain disease conditions like Crohn's or ulcerative colitis. I think nutritional support may include using a team member such as a dietitian, and often the physician is recommending that nutritional support.
Okay, great. And so how is it used in the treatment of IBD?
So as some of you people who are watching may know, IBD often can result in poor absorption of nutrients in the GI tract. So that might be because of either diarrhea or because the GI tract is inflamed. Or I think some patients who have IBD will have pain with taking food by mouth, maybe have reduced appetite, or they have something as part of their GI tract in their Crohn's disease, which make it difficult to take in food, such as a narrowing or a stricture. So I think with all of that, what can result is that there can be a loss of weight, or in children, who I see, we actually sometimes can see that they don't gain height very well. So we know that the lack of nutrition that's going through their GI tract from their IBD is not really being met with taking foods by mouth or supplements by mouth. So nutritional support, I think, can encompass a few different things. I think it can encompass treating the IBD itself, and we'll get into that a little bit more later. It can encompass replacing things that are lost from the GI tract, which may include things like vitamins or minerals, or it can encompass adding nutrition for weight gain specifically or height gain specifically. So nutritional support in general can be used for all those things. I think different approaches, which we're going to be talking about, can include things like giving nutrition through an IV or giving nutrition by mouth or by like a tube, either through the stomach or through the nose, or can come in the form of different supplements. So I think nutritional support encompasses all of that and can be used as part of IBD management.
So I know when we talk about nutritional support, we hear words like enteral and parenteral a lot. Can you explain what those are, and does one of them work better for IBD patients than the other?
Yeah, so I think any every case is different for sure, and so what might work for one person maybe doesn't work for another person. But I can give a little bit of a background about both of those things. So enteral nutrition, so the word enteric or enteral means the GI tract. So enteral nutrition just means that people are taking in nutrients through the GI tract. But when we talk about it with IBD, we tend to think of enteral nutrition as meaning something like a medical formula or a medical shake when it gets prescribed by a physician for IBD. This might be something that's used as like 100% of a patient's calories or partially as like less than 100%. So when it's used as 100%, we think of it as exclusive enteral nutrition, or EEN. And when it's used less than 100% of their calories, it's usually partial enteral nutrition, or PEN. Parenteral nutrition, on the other hand, means going around the GI tract, so not using the GI tract for nutrition. So this typically means then people might have heard of something called TPN, or total parenteral nutrition, which means all of the calories are coming outside of the GI tract, or PN, meaning parenteral nutrition, coming through an IV for some of the calories. So parenteral nutrition can be things like carbohydrates, proteins, fats, vitamins, minerals, electrolytes, but the point of it is that it all goes into an IV rather than through the GI tract, either by mouth or tube.
Okay, great. That's really helpful. So I'm going to jump around a little bit and go to you, Ty. I know you've been on nutritional support for years. Can you tell us a little bit about how you ended up on nutritional support, what your experience has been like, and how it's helped your disease?
Yeah. So when I first started getting sick, and I was diagnosed with Crohn's, my GI doctor decided, instead of doing steroids, she decided to put me on to enteral feeds through a G-tube for solely 6 months, where I did that and nothing else by mouth or anything like that, to put my flare at bay and whatnot. And then over the years, I have basically developed, or I use the enteral nutrition for about 80 to 100% of my nutrition, 365 days throughout the year. It basically has kept my IBD in remission for the past 4 years now. I have gotten off all of my meds, and now I'm on just nutritional support and whatnot. Since it is through my G-tube, it has to be a specific formula, and that formula does provide me with ample enough calories and all of the vitamins, minerals, and everything that I need. It has definitely given me a much easier take on my IBD. On top of my IBD, I have a swallowing disorder, so that on top of it helps my need for the G-tube issues and whatnot.
And just for people who are watching, what is a G-tube?
A G-tube is a tube that goes directly into the stomach, from the outside of the skin right directly into the stomach, and feeds into the stomach. I did have a GJ tube, which goes from the outside of the skin into the stomach and then down into the first portion of your small intestine, to bypass the stomach, and then it allows for you to vent when you are having bloating and other uncomfortable symptoms and whatnot, from the G port, from the stomach portion, and relieve those symptoms.
Okay. So in addition to nutritional support, a lot of patients might incorporate things like nutritional supplements or other medical foods into their treatment regimen. What's the difference between these and either enteral nutrition or parenteral nutrition? And is there any research supporting their use in IBD?
Yeah, so, and thank you, Ty, for talking about that. I think that helps us kind of jump into the part is there support for use. So I think first we'll talk about what medical foods are and what medical supplements are, and then get a little bit into how they're used. So a supplement, I guess by the FDA definition, is something that's taken by mouth that has a dietary component in it. So it might be something like a vitamin or a mineral or an herbal extract. It's not necessarily intended for the use of treating disease, but a lot of times it might be thought of as something that can help prevent disease, or in the case of deficiencies, perhaps it can be used to supplement something like vitamin D or iron for anemia. But typically supplements are not regulated by the FDA. They come out and then afterward are monitored. Whereas a medical food is something that is formulated, so it doesn't occur naturally. And it can be thought of as something like a medical formula or a medical shake that is intended to be taken through the GI tract as part of disease management. So that might be taken either by mouth or by a tube, like Ty was talking about, either through the stomach, or he was talking about through the jejunum, which is part of the intestine. So the medical food or medical formula is something that is thought to be medically necessary. It is part of disease management, and it can be used to feed someone either as 100% of calories like Ty was using earlier, or as part of their diet. In inflammatory bowel disease, especially, so I'm a pediatric gastroenterologist, and what Ty was talking about was using 100% of calories by nutrition, or 80, 100%, I think you said. And in pediatrics, we know that if we use 100% of calories for 6 to 8 weeks, we can actually use it as disease treatment, so it can put active disease into remission at the same rate as using steroids for disease. So that's pretty cool. And I think a lot of the world is using enteral nutrition or medical food or medical formula as Crohn's disease treatment. So that's specifically for Crohn's. In terms of other diseases or in terms of other uses of medical foods, we know, as we were talking about before, that with inflammatory bowel diseases, people might have poor growth or weight loss. It can certainly be used to boost their nutritional status, sometimes as a I won't misuse the word supplement, as part of their nutrition, and can also help in a surgical situation to boost their nutritional status before they go into surgery. So we think there's a lot of great use for medical foods and medical formula for Crohn's disease and ulcerative colitis.
So given that nutritional support is prescribed by a doctor, is it covered by insurance?
So typically not, unfortunately. So I think a lot of times insurances cover medications for disease, but because medical foods or medical formula are typically something that are also available over the counter, they tend to not cover it. The caveat is they often will cover it if it's given through a tube, so either through the nose or through the stomach, like we talked about, and that is something that's determined on a state-by-state basis. So on a national level, there's no mandate for coverage, and on state-by-state, it, for the most part, is not covered. I think New York State's the only state that has a mandate to cover medically necessary foods.
Go New York. So Ty, what obstacles have you faced in obtaining coverage for your nutritional support?
Yeah, so I live in Florida, and living in Florida is one of the states that does not actually cover, does not mandate the coverage of nutritional support. And so even though my food is prescribed from a doctor and I can't get it from, CVS and whatnot, I have to get it through the company that produces it. I have to pay out of pocket for it. My insurance company will pay for the bags and for the pump. However, they won't cover the nutritional side of it. That runs me anywhere between $20,000 a year for to meet my nutritional needs. And that all has to come out of pocket on top of, my insurance premiums and everything. So that is one of the biggest obstacles I've faced with getting it. And then since it is so expensive, I do have, and since I just graduated college, being in college, I had to live on a budget. So I was thankfully able to find a foundation that donates a lot of the food and will connect you with people that are donating the food. However, it pushed me to having to take food that was consume this food that was pushed to the expiration limit or just past the expiration limit because that was what was readily available. And since I couldn't afford to get necessarily from the company, I would have to get what was only available through donation. So those are the main obstacles that I found when being 80% dependent on the feeds, was that I had to go searching for it to find it at a reasonably priced aspect. And then when I found it, having to find one that wasn't expired and still okay to consume.
That's horrible, and nobody should have to deal with that when accessing the care that they need, which is a really great segue into the last thing we wanted to talk about today. So as part of the Foundation's mission, we are dedicated to advocating to ensure that all patients have access to the care and treatments that they need when they need them, one of them being medical nutrition. And so we're currently working to have the Medical Nutrition Equity Act passed by Congress. So Dr. Sandell, can you tell us a little bit about what the Medical Nutrition Equity Act is?
Sure. So I think this is really great. So I think what Ty was talking about is so important. You know, cost of medical food is often prohibitive. So because of that, people often turn to medications merely because it's impossible to pay for the cost of medical food, when a lot of times medical food can be used as treatment for their disease or in supportive treatment to reduce the risk of recurrence or needing other medications and to help with their nutritional status overall. So the Medical Nutrition Equity Act, this is the second time it's been introduced in Congress. So basically, it's a piece of legislation that's requesting that mandating that medically necessary foods and some vitamins be covered by public and private insurance for people who need them for certain disease conditions. So the legislation says that medically necessary foods are these products that are designed as part of disease treatments, like medical formulas like Ty is on, that are for diseases that are explicitly listed in this legislation. So inflammatory bowel diseases, including Crohn's, ulcerative colitis, and indeterminate colitis, would be covered under that legislation. So the bill was first introduced last Congress, so the 115th Congress, in both the House and the Senate. It needs to get support from both sides, the House and the Senate, before it can be passed into law. And in this 116th Congress, where we are now, it's currently introduced in the House and has not yet been introduced in the Senate, but hopefully will soon. So in the House of Representatives, the bill is called H.R. 2501, or the Medical Nutrition Equity Act of 2019. And it currently has 31 co-sponsors. So in order for a bill to gain momentum, for people to want to pass it, it needs co-sponsorship. And so it has 31 co-sponsors out of the 435 Congress people who potentially could co-sponsor it. In order to advocate for it, what we are asking people to do is to call or write or email their representative in Congress to say, we would love your co-sponsorship on the bill. And I think you can go online and find out who's already co-sponsored it, but again, only 31, so most likely your representative has not. And then the senators don't go off without any advocacy either. So we can call them and we can say that once the bill is introduced in the Senate, we would ask our senator for their co-sponsorship, as we anticipate it will be introduced soon.
And so just to clarify, what specific types of medical nutrition are covered by the bill?
So the bill does cover what it calls medically necessary food and some vitamins. And the medical necessary food is a formulated product, such as a formula that might go through a G-tube or drink taken by mouth, that is designed or designated as part of treatment for a disease condition. It also stipulates that the medical food is either prescribed or recommended by a physician or someone who is qualified to make that recommendation. And in this case, with inflammatory bowel diseases, likely will be a gastroenterologist. Some of the diseases listed in the legislation are outside of gastroenterology, but in this case, it would be under the care of a physician. And the intent is that it will be monitored by seeing that physician over time for management of that medical food. So there's a lot of words, but generally it includes things like medical formulas, like we think about, administered through a tube or taken by mouth. And then it does incorporate some vitamins as well. And those are used for treatment for something like inflammatory bowel disease.
Great. That's a really great explanation, because I know there's a lot of people out there who use different types of medical supplements to help manage their disease that may not be covered. So we just want to make sure everyone understands these are the formulas that are used for feeding tubes and very specific medical foods specified in this bill. So Ty, I know you were with us at Day on the Hill last year when we were advocating on this for the first time. Can you talk a little bit about what it was like sharing your story, what you heard from legislators regarding the bill?
Yeah, so a lot of them were very interested in my story. They were very shocked to hear how much I have to pay to cover my medical needs, on top of having to cover my medical insurance and whatnot. A lot of them were blown away by that, and when they first heard about this, the Medical Nutrition Equity Act, they were very interested in getting on board. So I would definitely say contacting your representatives is key here, because once they understand how important these supplements are to regulating your disease, to making to putting the disease almost into remission at some time, in some cases, I believe that they will come on board and help us out with this.
And Angela, I know you've been with us the last few years also talking about this. Do you have anything you want to add about what you experienced from talking to legislators about the bill?
Sure. I think that people are really receptive to the idea. I think when we talk about the fact that medical foods and medical nutrition tend to have fewer side effects, people tend to, it resonates the idea that you're feeding the gut, and that's a way that could potentially help with treatment, or at least help with disease management. I think people really understand that. And most importantly, I think the thing that resonates the most are the stories that people are telling of how it's affecting them and how it's affected them in a positive way. I think that there's just a general misunderstanding about how cost prohibitive these can be, and that because of that cost decision, sometimes we'll choose something differently just for that reason. And that when you alleviate the cost, which overall is generally not that expensive compared to other medications at times, that it can be really helpful for patients and families. And just getting the word out there is probably the most important thing.
Great. So I know we talked very quickly, but how can patients, caregivers, and providers get involved to help advocate for passage of this bill?
Yeah, so again, I think the best way to do it is to tell your story, whether that's, sometimes it seems like it might be scary to call. So even if you do it in an email or a letter, and it's actually not that scary to call, and just tell your story. People want to hear it. They're listening. You are their constituents. They're open. And I think really having people understand the face of what people are going through is the best way. And so from my end, I try to do it as the provider, as the physician, to say that I've seen patients over and over get denied coverage for medical foods and medical formula, and it really have a severe effect on them. I talked to legislators about one patient in particular I can think of, needed vaccination with a live vaccine, and so we wanted to have her use medical food as her primary treatment for her Crohn's disease. But because it wasn't covered, it was cost prohibitive. She wasn't able to get her measles vaccine before starting immunosuppressive therapy, and we know that's like such an important issue right now. So really just taking these stories that we're all experiencing every day and thinking about them every day and translating that to hopefully advocate for coverage for medical foods.
Ty, do you have any tips you want to share?
Like Angela said, getting out there and telling your story. That we are their constituents, and they are there to work for us. They want to hear our stories. They want to hear our parts of this struggle and whatnot. And whether it's a patient, whether it's the caregiver or the provider, there are so many different pieces of this story. And once all of these pieces are put together, it will really have an impact on how the representatives approach the Medical Nutrition Equity Act, and hopefully get on board with this. So get out there and contact everyone.
Well, that's all the time we have for today's Facebook chat. If you have questions that weren't answered, please continue to comment. I will go back through and make sure I respond to everyone. I want to say thank you to Dr. Sandell and Ty for participating in today's chat and for all that you do for IBD patients. Is there anything else you guys want to add before we sign off?
Just thank you for having us, and I'm happy to be here and talk about something I feel really passionate about.
Yeah. Thank you. Thank you so much.
So all of you watching can help us get the Medical Nutrition Equity Act passed by Congress. And the easiest way to do this is by joining our advocacy network. And you can do this by visiting www.crohnscolitisfoundation.org/advocacy. And when you sign up for this, you'll get an email from us monthly, sometimes more than that if there's opportunities for you to be taking action. And we will give you super easy instructions on how to reach out to your member of Congress and let them know that you want the Medical Nutrition Equity Act or other important pieces of legislation passed by Congress. And again, if we didn't get to your question today, you can also contact the IBD Help Center at info@crohnscolitisfoundation.org or 888-MY-GUT-PAIN. And you can always visit our website, which is available when these other resources are not, at www.crohnscolitisfoundation.org. Thanks, everybody, for joining us today, and I hope you have a great afternoon. Bye.
Thank you. Bye.